There are over 12,000 diseases in the world. Some take years to diagnose and treat. How can doctors find insights in a body of medical knowledge that doubles every 5 years? New solutions based on IBM Watson are being developed to help doctors analyze a patient's history, symptoms, and the latest medical literature to make faster, more accurate diagnoses.
Hello, my name is Watson.
Let's build a smarter planet.
Please welcome Jason Tanz, New York editor, Wired, with Basit Chaudrhy, medical scientist and lead research clinician for Watson IBM.
Welcome back. Thanks for joining us. Thanks to everyone online who's watching from across the globe. So we've just watched a short video about Watson, which I always associated with Jeopardy, as I imagine most of us do. So talk to us, Dr. Chaudhry, a little bit about what Watson's role might be in the doctor's office.
It's a great question. I think Jeopardy presented us an initial set of challenges, and I think we've been eager to adapt the technology to different industries to create solutions that are going to have meaningful value to people and what they're hoping to accomplish. I think healthcare has been one of the ones we've prioritized, and I think what we roughly see Watson doing is helping people deal with the cognitive burden of healthcare and medicine. And what do I mean by that? I think the experience of getting healthcare for patients and consumers is often overwhelming. The experience of doing it as a physician is often overwhelming to provide. I think even subspecialists in their field, for instance, can't really keep up with all the things they need to read just to practice medicine the best way that they can. So we envision Watson as a model for cognitive computing where it's providing support to people for the different kinds of reasoning tasks that they have to engage in to accomplish their work efficiently. So I think roughly sort of as an outline, that's part of what we're envisioning here. How do we reduce the cognitive burden on people as they seek and provide medical care?
So it's to help parse the deluge of information that keeps coming in every day with new studies and the latest research, but also to help fit a patient into a broader sort of network of information. Is that right? Yeah,
that's exactly right. I think it's a good way of thinking about it. I think we think about models like personalized medicine, which we've discussed a lot here. Yeah. That's the future. It's partly the question here is how do we operationalize that? How do we put it into practice? So if we have all these different dimensions of data about an individual, and we want to provide them with the best care possible, how do we match, say, the different characteristics they have, personal, medical, things like that, their preferences, with a set of knowledge and information which is going to define what the best thing to do for them is. And I think it's very difficult to do that just through human cognitive capacity alone.
Right, and we're entering an age in which data is more important than ever. Obviously we've talked a lot about quality-based care as opposed to fee-for-service, things like that. Talk about what some of the new data challenges are that we're going to be facing as we move to this new model of medicine.
Sure. I think there's just tremendous change and vibrancy across healthcare right now. I think the way it's oriented is changing rapidly. We're moving to more consumer and patient-centered model. We're focusing more on health rather than disease. The practice of medicine is changing. We're moving to more personalization and predictive medicine. On the flip side, we're developing a much broader base for things like primary care to enhance wellness and prevention. The way medicine and healthcare are paid for and the business models that are supporting them are changing rapidly. The way science is being practiced, things like adaptive clinical trials, for example. There's a great deal of innovation there as well. And I think the thing that brings many of these threads together is the importance of data and knowledge and extracting value from that data. And I think that's sort of one of the fundamental foundations that's being put in place for the future of health, healthcare, and medicine.
And we were talking backstage about some of the risks of a purely data-driven model that, for instance, if you are basing payment on statistics, right, readmission rates or what have you, that data had better be high quality, right? So we've all had the experience of working with some piece of enterprise software that required you to enter various numbers in various boxes, and sometimes they give a full picture and sometimes they don't. Talk to me about how you guys are thinking about that challenge and what Watson might represent in that regard.
Yeah, it's a very good question. I think when you have these really complicated issues, one of the ways to think about data and use it is to think about there's many different dimensions to the problem, and different kinds of data are going to address different dimensions. So just take, for example, one of the areas I think we really need to have a much better understanding of to provide more humane care is patient experience. Right? What is it like to receive medical care? What is it like to be inside of the healthcare system? What are your priorities and goals? And I think that's, for example, a set of activities which is really difficult to put into pick lists, or it's really difficult to kind of use structured data to get at that. A lot of the humane aspects of medicine are related to narrative features in medicine. I think one of the things we're hopeful about Watson is that we can capture some of these dimensions through natural language and allow people to interact with technology in ways which are more organic to them.
So give me an example of what that might look like. If I'm trying to figure out what a patient experience at my hospital is like, how would I be able to determine that now, and how might I be able to determine that using something like Watson?
That's a good example. So I think there's going to be a couple different levels to that, but just as an immediate example, a lot of patient experience right now for, say, when someone's in a hospital is captured by nursing notes. And those are generally handwritten notes, and the nurses make a bunch of observations during their shift. In general, that data isn't really extensively used. It's very common that physicians just don't have the time or patience to read through it. It's in places which aren't convenient to access. It's all narrative, so it doesn't necessarily pop up into different fields in, say, an electronic health record.
Right, so it's not easy to quantify.
It's not easy to quantify. And I think bringing new kinds of techniques, new kinds of technologies, particularly with respect to this kind of unstructured narrative data, is going to provide new avenues to mine that type of experience and try to get more understanding and insight of what it's like when someone comes in and doesn't allow you to sleep, or things like that. Important things on improving the performance and productivity of the healthcare system.
So in other words, if you're using something like natural language processing, you can extract information from those notes rather than having them have to be converted into data. You could say, oh, I see that this person didn't sleep for the last 6 nights or something, because that was in the notes. It wasn't because somebody went through and ticked a box that said.
Yeah, exactly. I think, and this is just an example, but it's just one of the things that personally, from a clinical point of view, comes to mind quite a bit when I think about sort of what is the future going to look like. And I think understanding these dimensions of patient experience really are important. And I think that was one of the nice challenges of Jeopardy. Language is so nuanced, and the kinds of things that are asked in Jeopardy are quite difficult to interpret. So it created a really concrete set of challenges that we've been able to now sort of extend and start applying to the domain of medicine.
All right, so let's pull back the lens a little bit. I mean, we've talked a little bit about the patient-doctor experience. How can hospitals use unstructured data to improve their operations? Again, we're entering an age in which quality of care is becoming an important metric. But figuring out how to represent that metric is its own kind of challenge. So talk to me a little bit about how technologies like Watson can be used to help hospitals understand what they're doing well and maybe what they're not doing so well.
Yeah, it's again, another really difficult and good question. I think, again, a lot of this is, the way physicians in particular, and nurses and healthcare professions tend to document information and record it for themselves tends to be in a very unstructured way. It might be in different kinds of clinical notes. And I think that's sort of the way people are accustomed to working and the way that feels most comfortable to them. So a lot of the insight that's involved in the care activity experience for providers and professionals isn't captured in these kinds of notes. I think being able to extract information from that kind of data, process it in ways where you can draw insight and organize the knowledge involved with it, I think is going to be really important to what we can do and the flexibility we can create for healthcare professionals in the future.
And as compensation becomes tied to quality of care, we talked a little bit about this backstage, that if you're talking about structured data, like for instance with the US News and World Report's college rankings, right, you find some of the schools essentially teaching to the test, right? They're trying to maximize the kind of data that they can report. So it sounds like unstructured data may allow a way out of that kind of conundrum.
I think it's going to be really important because, again, a lot of these things we're trying to measure, like I think measurement, quantification, data, for all these recurring themes about change in healthcare. they're trying to get at really complex ideas that are going on in people's lives, complex things people are doing in their own work. So the more dimensions of that we can capture, the better off we're going to be. And I think that's going to help us avoid things like teaching to the test, because you can look at not just one single metric that might capture one dimension of an issue, but many of them. And I think many of those are going to be in unstructured data, and combining both structured and unstructured data I think is going to be important for the future.
So can you give me, again, an example of what that might look like if done right?
Sure. So right now, say for someone with diabetes, one of the common ways we look to collect data or measure and quantify the kinds of care that they're getting is to ascertain whether or not someone's had their feet checked. Right? So this is one of the really most common quality metrics and sources of data related to diabetes care. Has a physician checked this patient's feet? That's an important thing to do, but the entire sort of universe of things, or the ways we want to treat people with diabetes, far exceed these kinds of particular narrow metrics. Right? I can check someone's feet, but that doesn't mean I've treated them humanely.
Right.
That doesn't mean I've understood the complexity of what it's like to take insulin for them, or to try to deal with low blood sugar as it happens. And these are, I think, really complex ideas, but these are really, I think, what attunes the dynamics of someone's life when they have that kind of chronic condition. Mm-hmm. I think gaining insight into that is going to be really important to fundamentally changing the way we practice medicine and the way people receive care.
And to pull back the lens even further, one of the great challenges we're facing as a country is how to bend the cost curve, how to make medical care more affordable generally. Is that the kind of thing that can be aided by this sort of technology as well?
Yeah, I think that there's just tremendous promise for learning from data at large, and the impact that can have on doing things like making medicine more productive, making healthcare more efficient, bending the cost curve, as you said. And having data and information at hand is going to be foundational to that. And again, these types of approaches with unstructured data and things like notes, hopefully images in the future, things like that, are going to be really, I think, critical to doing that kind of thing and achieving the kind of endpoints that we're hoping to.
Mm-hmm. Mm-hmm. So, again, maybe walk me through what a doctor would go through and a hospital would go through. From the time a patient comes in, how is my practice going to change in the world of unstructured data, using that as an assistant?
That's a great question. So, one of the things we're working on right now, I think with movement towards more personalized medicine, it's getting harder and harder to pick which is the best pathway for care for a particular patient. Right? That's becoming a real challenge. In the future, if we're understanding patients potentially hundreds and hundreds of different dimensions or features of what's involved in their sort of demographics or their medical care, we're going to wind up not with one treatment, but many treatments for people with particular sets of conditions. How to choose between one pathway or another is really difficult. Right? And I think we're going to have to create a whole new cadre of cognitive support and cognitive support tools for this type of activity. So if a patient may come in, they may have a certain genomic profile, may have a certain metabolomic profile. These are all different kinds of features. They're going to have different preferences and goals. Right? So there, I think you can see that some of these things are going to involve very, discrete, structured data, like things like, their genomic information.
Right.
But, what their preferences, what their goals are for their care, how they choose to make trade-offs, what they're prioritizing, all those things I think are really rich, complex, and what really sort of shape people's lives. Mm-hmm. I think being able to bring those things together and then pick, well, for this person, based on their characteristics and their preferences, what's the, quote-unquote, optimal thing to do for them? That becomes a real possibility in the future.
Mm-hmm. Mm-hmm. Great. Well, amazingly, we were already out of time. It went really fast, but thanks for a fascinating talk.
Thank you.